NCELX Q&A Daily Practice Part 10. 1. The nurse is teaching a client about the healthy use of ego defense mechanisms. An appropriate goal for this client would be: A. Reduce fear and protect self-esteem. B. Minimize anxiety and delay apprehension. C. Avoid conflict and leave unpleasant situations. D. Increase independence and communicate more often. 1a. Reduce fear and protect self-esteem. Ego defense mechanisms are unconscious proactive barriers that are used to manage instinct and affect in the presence of stressful situations. Healthy reactions are those in which the client admits that they are feeling various emotions. 2. A child with tetralogy of Fallot visits the clinic several weeks before planned surgery. The nurse should give priority attention to: A. Assessment of oxygenation. B. Observation for developmental delays. C. Prevention of infection. D. Maintenance of adequate nutrition. 2a. Assessment of oxygenation. All of the above would be important in a child diagnosed with tetralogy of Fallot. However, persistent hypoxemia causes acidosis, which further decreases pulmonary blood flow. Additionally, low oxygenation leads to development of polycythemia and resultant neurologic complications. 3. The registered nurse, RN, is planning care at a team meeting for a 2-month-old child in bilateral leg casts for congenital clubfoot. Which of these outcomes suggested by the practical nurse, PN, should be considered the priority nursing goal following cast application? A. The infant will experience minimal pain. B. Muscle spasms will be relieved. C. Mobility will be managed as tolerated. D. Tissue perfusion will be maintained. 3d. Tissue perfusion will be maintained. Immediately following cast application, the chief goal is to maintain circulation and tissue perfusion around the cast. Permanent tissue damage can occur within a few hours if perfusion is not maintained. 4. At a nursing staff meeting, there is discussion of perceived inequities in weekend staff assignments. As a follow-up, the nurse manager should initially: A. Allow the staff to change assignments. B. Clarify reasons for current assignments. C. Help staff see the complexity of issues. D. Facilitate creative thinking on staffing. For D. Facilitate creative thinking on staffing. The moving phase of change involves viewing the problem from a new perspective, and then incorporating new and different approaches to the problem. The manager, as a change agent, can facilitate staff solving the problem. 5. A client is admitted with a distended bladder due to the inability to void. The nurse obtains an order to catheterize the client, and is aware that gradual emptying is preferred over complete emptying because it reduces the: A. Potential for renal collapse. B. Potential for shock. C. Intensity of bladder spasms. D. Chance of bladder atrophy. 5b. Potential for shock. Complete, rapid emptying can cause shock and hypotension due to sudden changes in the abdominal cavity. 6. The nurse is assessing a 12-year-old who has hemophilia A. Which finding would the nurse anticipate? A. An excess of red blood cells. B. An excess of white blood cells. C. A deficiency of clotting factor 8. D. A deficiency of clotting factors 8 and 9. 6c. Hemophilia A is characterized by an absence or deficiency of factor 8. 7. The nurse is caring for a client with left ventricular heart failure. Which one of the following assessments is an early indication of inadequate oxygen transport? A. Crackles in the lungs. B. Confusion and restlessness. C. Distended neck veins. D. Use of accessory muscles. 7b. Confusion and restlessness. Neurological changes, including impaired mental status, are early signs of inadequate oxygenation. 8. A 6-year-old female is diagnosed with recurrent urinary tract infections, UTIs. Which one of the following instructions would be best for the nurse to tell the caregiver? A. Increase bladder tone by delaying voiding. B. When laundering clothing, rinse several times. C. Use plain water for the bath, shampooing hair last. D. Have the child use antibacterial soaps while bathing. 8C. Use plain water for the bath, shampooing hair last. Hair should be shampooed last with a rinsing of plain water over the genital area. The oils in soaps and bubble bath can cause irritation, which may lead to UTIs in young girls. 9. While performing an initial assessment on a newborn following a breech delivery, the nurse suspects hip dislocation. Which of the following is most suggestive of the abnormality? A. Flexion of lower extremities. B. Negative ortolani response. C. Lengthened leg of affected side. D. Irregular hip symmetry. 9D. Irregular hip symmetry. Early assessment of irregular hip symmetry alerts the nurse and the provider to a correctable congenital hip dislocation. 10. In reviewing the assessment data of a client suspected of having diabetes insipidus, the nurse expects which of the following after a water deprivation test? A. Increased edema and weight gain. B. Unchanged urine-specific gravity. C. Rapid protein excretion. D. Decreased blood potassium. 10B. Unchanged urine-specific gravity. When fluids are restricted, the client continues to excrete large amounts of dilute urine. This finding supports the diagnosis. Normally, urine is more concentrated with reduced fluid intake. 11. The nurse is caring for a client with Parkinson's disease. The client spends over 1 hour to dress for scheduled therapies. What is the most appropriate action for the nurse to take in this situation? A. Ask family members to dress the client. B. Encourage the client to dress more quickly. C. Allow the client the time needed to dress. D. Demonstrate methods on how to dress more quickly. 11C. Allow the client the time needed to dress. Clients with Parkinson's disease often wish to take care of themselves but become very upset when hurried and then are unable to manage at all. Any form of hurrying the client will result in a very upset and immobilized client. 12. When caring for a client with advanced cirrhosis of the liver, which nursing diagnosis should take priority? A. Risk for injury, hemorrhage. B. Risk for injury related to peripheral neuropathy. C. Altered nutrition, less than body requirements. D. Fluid volume excess, ascites. 12A. Risk for injury, hemorrhage. Liver disease interferes with the production of prothrombin and other factors essential for blood clotting. Hemorrhage, especially from esophageal varices, can be life-threatening. This takes priority over the other nursing diagnosis. 13. A client is admitted with a diagnosis of myocardial infarction, MI. The client is complaining of chest pain. The nurse knows that pain related to an MI is due to A. Insufficient oxygenation of the cardiac muscle. B. Potential circulatory overload. C. Left ventricular overload. D. Electrolyte imbalance. 13A. Insufficient oxygenation of the cardiac muscle. Due to ischemia of the heart muscle, the client experiences pain. This happens because an MI can block or interfere with the normal cardiac circulation. 14. On initial examination of a 15-month-old child with suspected otitis media, which group of findings would the registered nurse, RN, anticipate? A. Periorbital edema, absent light reflex and translucent tympanic membrane. B. Irritability, rhinorrhea, and bulging tympanic membrane. C. Diarrhea, retracted tympanic membrane and enlarged parotid gland. D. Vomiting, pulling at ears and pearly white tympanic membrane. 14B. Irritability, rhinorrhea, and bulging tympanic membrane. Clinical manifestations of otitis media include irritability, rhinorrhea, bulging tympanic membrane, and pulling at ears. 15. Postoperative orders for a client undergoing a mitral valve replacement include monitoring pulmonary artery pressure together with pulmonary capillary wedge pressure with a pulmonary artery catheter. The purpose of these actions by the nurse is to assess A. Right ventricular pressure. B. Left ventricular and diastolic pressure. C. Acid-base balance. D. Coronary artery stability. 15b. Left ventricular and diastolic pressure. The pulmonary capillary wedge pressure is reflective of left ventricular and diastolic pressure. Pulmonary artery pressures are an assessment tool used to determine the ability of the heart to receive and pump blood effectively. 16. A client is receiving oxygen therapy via a nasal cannula. When providing nursing care, which of the following interventions would be appropriate? A. Determine that adequate mist is supplied. B. Inspect the nares and ears for skin breakdown. C. Lubricate the tips of the cannula before insertion. D. Maintain sterile technique when handling cannula. 16b. Inspect the nares and ears for skin breakdown. Oxygen therapy can cause drying of the nasal mucosa. Pressure from the tubing can cause skin irritation. Nasal cannula administering oxygen should not be lubricated with petroleum jelly. 17. The nurse is providing instructions for a client with asthma who is sensitive to house dust mites. Which information about prevention of asthma episodes would be the most helpful to include during the teaching? A. Change the pillow covers every month. B. Wash bed linens in warm water with a cold rinse. C. Wash and rinse the bed linens in hot water. D. Use air filters in the furnace system. 17c. Wash and rinse the bed linens in hot water. For asthma clients who are sensitive to house dust mites, it is essential the mattresses and pillows are encased in allergen-impermeable covers. All bed linens such as pillowcases, sheets and blankets should be washed and rinsed weekly in hot water at temperatures above 130 degrees Fahrenheit, the temperature necessary to kill the dust mites. 18. A client tells the nurse he is fearful of planned surgery because of evil thoughts about a family member. What is the best initial response by the nurse? A. Call a chaplain. B. Deny the feelings. C. Cite recovery statistics. D. Listen to the client. 18d. Listen to the client. Therapeutic communications are based on attentive listening to expressed feelings. If the nurse is not familiar with the cultural beliefs of a client, acceptance of feelings is followed by questions about the beliefs. 19. The nurse is performing a physical assessment on a client with insulin-dependent diabetes mellitus. Which client finding calls for immediate nursing action? A. Diaphoresis and shakiness. B. Reduced lower leg sensation. C. Intense thirst and hunger. D. Painful hematoma on thigh. 19a. Diaphoresis and shakiness. Diaphoresis is a sign of hypoglycemia which warrants immediate attention. 20. A Hispanic client refuses emergency room treatment until a curandero is called. The nurse understands that this person brings what to situations of illness? A. Holistic healing. B. Spiritual advising. C. Herbal preparations. D. Witchcraft potions. 20a. Holistic healing. This traditional folk practitioner uses holistic methods for illnesses not related to witchcraft. Many times, the curandero works with traditional healthcare providers to restore health.